Well, hello, my name is Karleen Halleck. I am the executive pastor of Epic Church here in Mishawaka, Indiana. And I am also a registered nurse, and I'm here with three others. I'm here with Jeremy Levan, the founding pastor of Epic Church, Dr. Justin Schwalbe, who attends Epic, but is also the family doctor at South Bend Clinic. And then I'm also here with Dr. Martin Majors, who grew up in Michiana. He's a friend of Epic Church. He's traveled with Epic, and now he's a pathologist in Ann Arbor, Michigan, and a partner in the IHA pathology group. And I'm going to start with you, Dr. Martin. Would you just explain what is a pathologist and what do you do?
Yeah, so we do a lot of things. Usually we spend most of our time sort of diagnosing cancer with biopsies and resections, but a big thing of what we're involved with right now is testing for infectious diseases, specifically the COVID-19 virus.
Guys, I believe that most pastors and church leaders feel the weight of leading in a way that is both wise and honoring to God. And, you know, in many pastors, we feel the weight that if we don't get it right, that souls are literally at stake. It's a heavy burden to carry. And yet, as a pastor and a church leader, it can be difficult to keep up with all this information that's out there. It's difficult to know what's credible, what's not. And so I just wanted to bring some people in that are more local, guys that I trust, and that I know that have a whole lot more insight about this virus than I do. Because I believe that we can, when we have good information that we can actually trust, I believe as leaders, we can generally make good decisions. And so that's really the purpose of this conversation. And I really appreciate the both of you taking time out of your busy schedules to be with us and to share your insight with us.
Happy to be here.
Guys, I've literally heard people say that this virus and this pandemic is so overblown. And yet I was talking with someone last night that was literally wondering if this was going to be the end of the world. How serious is this pandemic? Is this something that is overblown? What are your thoughts?
It's serious. I'll just kind of step back. What is coronavirus, first of all? It's a highly contagious viral pneumonia. The world has never seen it before. It's something that our bodies don't have any antibodies to, and so we don't have any defenses against it. We've never seen it before. Unlike certain other viruses that we see seasonally, which our bodies can be like, oh, we know this, we got this. We don't. We've never seen it before. It's brand new. Nobody in the world. It's new. That's a problem. U.S. death rates predicted by the CDC somewhere between 200,000 on the low end, 1.7 million on the high end, maybe more. I don't know. Still it changes every day. So it's a big deal.
Yeah. Well, with that said, I've heard people say, you know, but the flu seems more deadly than the coronavirus. I mean, so compare the differences here. I think you kind of alluded to some of that, guys, but what's more serious? Is coronavirus or the flu more serious? And, you know, unpack the differences there a little more.
So I think it is relevant to mention the flu because I think that the closest thing to sort of picture what we're going through right now is the 1918 flu pandemic, which if you look that up, you'll read that at least 20 million people worldwide died from that, and probably more than 50 million, possibly as many as 100 million people died from that. So yeah, certainly the flu is nothing to joke about. And my opinion is that people should take the flu much more seriously than they do in general. But we have vaccines for the flu. When seasonal flu happens, we typically see cases trickle into the hospital in such a way that the hospital isn't overwhelmed. So if there is a severe case of the flu, that patient often can be treated on something like a ventilator or, whatever it is they need. Like Justin said, the coronavirus that we're encountering now is a new type of coronavirus that we've never seen before. So we have no immunity, we have no vaccine, and we have no treatment. There's some things that have been mentioned as possibilities that maybe in the future we'll be able to use, but we have no vaccine or treatment for it right now. So all that to say, although most people who get coronavirus will have mild, even asymptomatic infection, probably between 1% and 5% of people who get the coronavirus will unfortunately die. And that number may seem small, but that is 5 to 10 times what the death rate of the flu is. And the big problem that we're really trying to prevent is if the healthcare system, if the hospitals are overwhelmed and we run out of ventilators, we run out of space in the hospitals, we're not going to be able to treat these patients, and that mortality rate is going to increase even more. So all that to say, the coronavirus that we're currently dealing with certainly is, at this point at least, more deadly than the seasonal flu.
And even mortality numbers aside, more people are needing hospital beds, more people are needing ventilators, which at some point we will run out of. And that brings me back to, okay, what if I have a heart attack? What if I have a stroke? What if I just break my ankle? The hospital beds they're gone. There's no room for you. They're turning people away. That's happening in Italy. So it's scary, and it is more contagious also because when you have the flu, you're contagious when you're sick. When you feel it, you're like, oh, I don't feel good. I should probably stay away from people. It seems, everything is new. We're still figuring things out every day, but it seems like COVID-19 or coronavirus that we're talking about is more, or at least is contagious the couple days before you develop symptoms. So people are walking around feeling fine, spreading it to other people.
So I need to ask a clarifying question from you guys. As a leader, as a church leader, and I'm networked with many leaders from different parts of the country and such. And some of this is based on different states. We're told, not to meet in groups of 250 people. And then some places they say, you can meet in groups of 50 people, but no more than that. And then we're also hearing, like, don't get into groups of more than 10. And so it's a little bit confusing. So how should we go about this? What's the standard that we should follow as leaders, as we're trying to lead our churches and such? Which is it?
I tell my patients just to stay home. Don't go anywhere. If you need to go out get some groceries, do that. If you can get them delivered, it's even better. If you absolutely have to go to work, if you can't do it from home, okay. But if there's anything that's elective, anything at all, don't do it. I think if we would have gone, instead of at 250, if we would have gone right down to the stay at home, don't meet in groups at all, I think we would be so much better off if that happened.
And I know that there are more and more people that are getting tested, and yet it's taking longer for the results to come back from the test. And so let's just say if I live in a household with someone who has gotten tested, but we're waiting for the results, is it that big of a deal if I go out into the public, even if I'm feeling fine to get groceries or get prescriptions or go to work? If I have someone in my home that has gotten tested, what do we as a household do? What would be your recommendation?
I think the guidance that my healthcare organization is giving is that if you live in a household where somebody tests positive, you should assume that you are positive as well, and quarantine yourself appropriately.
Until they come back negative, or
Okay. Yeah.
So no going and getting groceries is what you're saying.
Right. Call someone else.
So say I test positive, and my wife, a day later tests negative. That doesn't necessarily mean that she's not going to get it. She should, I should quarantine myself from her as much as possible, but she still needs to be careful.
So along those lines, we've heard that those who are in the older population are those who are most vulnerable and the ones who are most at risk. But has that changed? And is it true that now younger people can also be at risk for this virus? And if that's true, how serious is that risk?
I don't know if it's the difference in populations of different countries or just testing differently, but it seems to have changed since we first heard about it, and it does seem like younger people are getting more ill in a higher percentage.
Yeah, I mean, I think most of the people who unfortunately develop severe infection or pass away will be older people, people with coexisting medical problems. But I think to assume that because you are young, you will be safe is wrong. And yeah, like Justin said, I think we are seeing data now that young people are getting infected and more severely ill than you might otherwise expect with something like the seasonal flu. It's not safe to assume that this is just going to be older people who are severely affected by this.
So, guys, you had mentioned that we got to be careful about not overrunning the hospitals and the ICUs here in our country, and more people are getting sick. Realistically, are we doing well with this? Are we on pace to not do this, or how soon could we be looking to overrun the hospitals and ICU? Where are we at in all of this?
Well, if you look at data coming from Italy and kind of track where we are based on them, uh, we're we're behind them in terms of when we first had the same number of like 100 infections in the country, but we are like at pace with them. We're pretty much right on the same course, which is scary. We have a different population, but that still is not a good sign.
Yeah, I'll second that totally. And so there's a website that tracks the number of new cases and deaths relatively well. And if you look at that, it shows that yesterday New York had about 10,000 cases, and today New York has about 16,000 cases. That is 5,000 to 6,000 more cases in New York in one day. And if you look at yesterday, New York had 56 total deaths, and today they have 114. That doubled since yesterday. Sobering.
Yeah. And the other thing is a lot of the data we're having on just sheer numbers is lagging behind. I don't know about like New York or other labs, but our lab, it's taking like a week at this point to get a diagnosis.
Yeah.
So all the data we have is like 7 days old at this point, and we're on I think like day 13 in total. So I mean, yeah, it just gives me chills.
Guys, in the history of pandemics, we often would see the church step up and help make a difference. And so, with that in mind, as we think of where we're at today, what are some ways that we can partner with the medical community to help make a difference in this season of uncertainty that we're living in right now?
With everything that's going on, blood donation has really decreased, and we're really facing a shortage of blood supplies. So, if you're feeling healthy, I would really encourage you to make a blood donation. Number one, you will save lives. Number two, it is, in my opinion, aside from perhaps work, the only valid reason to get out of the house and go somewhere. Um, and so if you go to redcross.org, you can schedule a blood donation there. And if you're concerned about going there and getting infected, when I donated blood last week, I'll tell you the experience I had. I walked in, they took my temperature, they made me wash my hands. There was a big waiting area where people could space themselves out appropriately. So these places are taking appropriate precautions to keep you safe when you go. So all that to say, I think a very tangible way to sort of love your community is to donate blood if you're able to.
Yeah, doing is we know that there's a shortage of PPE or the masks, the gowns, things like that. There's been a big social media thing about helping to make masks, and well, I hope I never have to use one. It's going to be better than a bandana or a scarf. CDC just said if we run out of masks, which we're probably going to do, then they say it's okay to use a bandana or a scarf. So if you have a sewing kit, sewing needle, I don't know, machine, and you can get some of those supplies if you already have them, you can make some masks that would help. You can donate those to the local hospital, something like that. Checking on your neighbors, we call it social distancing, but we were talking about it earlier, like it really should be called physical distancing, and I really like that a lot better. So you can still be social. You can still check on your neighbors, call them, send them a text. Hey, do you need me to pick anything up? I'm getting a grocery order to be delivered. I can grab a couple extra things for you. Do we need to do that for you? Also, as I was brainstorming, another thing is just like helping as a church leader to help make sure your church is ready should there be a need, an influx of, hey, there's no more beds, there's no more rooms, can we use your church? And that's a very possible need.
You know, both of you have provided just some really practical things that individuals can do. But I know that one thing that can be really hard for pastors of local churches is, you know, you don't want to be the only person that's making a hard decision that could potentially be seen as hurting the church, because it can look like it's based out of fear. And yet, on the other hand, there's this tendency to maybe over spiritualize boldness. And so many local churches, they're part of denominations or networks. So what type of action and responsibility do you think that denominational leaders need to take during the season that we find ourselves in?
You know, we've been hearing news. We heard the front lines. So China first, then Italy, now New York, and Washington. You know, we're hearing reports from the front lines saying this is not good. We need to take it seriously. And it hurts me as a physician to see people not take it seriously, especially my fellow brothers and sisters in Christ, where I'm realizing that they're putting me at risk by not taking it seriously. So I know it's not the popular opinion sometimes, but they need to be the ones who are willing to stand up and say, listen, this is what the people who are out there are saying. We need to do what they're saying. We need to back up the medical community. We need to keep them safe so they can do their job.
Yeah, I totally agree. I mean, I have little confidence that a church pastor is going to listen to what I say, but they'll probably listen to what their denominational leader says. So I would really encourage those leaders to set an example and really have people not congregate together, really leverage technology to sort of do church that way whenever possible, and just stay home.
Great. Well, guys, I really appreciate your time. And I just want to, as we close out our time here, I just want to share this. You know, the other day I shared a post about church leaders that in South Korea, and now they're under tremendous scrutiny because they chose to continue to meet in person in the midst of the corona crisis. And I recently saw a governor in our own country that has begun pointing fingers at churches that are continuing to meet in person. Albeit, you know, it seems like he was speaking to those that are meeting in larger group gatherings. And the CDC is recommending that we don't meet in non-essential meetings of more than 10 people. And so, you know, as we've just heard from you guys and really most within the medical community that we've talked with, they're asking that we not meet in person at all. And so to my brothers and sisters in Christ that are listening to this, I want to encourage you, especially those that are church leaders, to consider this and to ask, how can we prayerfully become more creative? How can we do more to help our communities? If you're like me, your head is spinning as a result of this situation. You know, this situation continues to evolve and deteriorate, and our plans and our responses, I mean, they're literally changing by the day and even by the hour at times. But what seems like a great idea a few days ago may not be the best idea today. And so church leaders and pastors, I want to encourage you to consider this season that we're in and to try and keep ahead as best as possible. And I know that this is grueling. I know this is tough to lead through. And if you're like me, you're working on little sleep, but you're really praying a lot to try to have wisdom and ask God to help you to know how to adapt. You know, at this point, most of our society has moved or will move to more of physical distancing. And this includes our schools, our local restaurants, non-essential businesses. And some states right now are in complete stay-at-home mandates. So this begs the question as church leaders for us to pivot again and to think about ways that we can still love our congregation and love our community while simultaneously promoting the utmost safety. And so my prayer and my heart is that as Christ followers, we won't be seen as a detriment and an easy target for expediting the loss of life during this pandemic, but that we would be seen as a loving front line of defense to help make a difference, to help slow down and ultimately defeat this insidious virus. And you know, with God's help, I think together we could help make this happen.
Yeah. Jerry, I just wanted to share one last quote that I was reading just before coming here. And I guess I'm just going to read it because it really got to me with what you're saying too, and it really hit home. So it goes like this: in Italy, 8.3% of coronavirus cases involve health workers. A doctor in the Seattle area who is forced to reuse N95 masks told me that she and her colleagues fear the lack of supplies will be deadly. And I've got 3 girls, so this is the part that really struck home. We are all making dying contingency plans at this point, just in case, she said. Wills, backup people to take care of the kids, and recording bedtime stories. Serious.
Hard to imagine. And Justin and Martin, I am so thankful for you guys, and I'm grateful for what you guys are doing, and that you guys are out there, doing this to make a difference. And it's about saving lives. And so may we do our part to join with you guys to help save lives and to love our community well, and to not unnecessarily put people like yourselves at risk, as well as our other brothers and sisters in Christ, as well as our neighbors and other family members. And so let's all do our part. Thanks, guys. Appreciate you.
Thanks. My pleasure.